All the protocol remain observed. It gives me pleasure to preside over this high-level dialogue on HIV prevention in South Sudan, and particularly to affirm the commitment of the government of South Sudan, working with all partners and the community and communities to end AIDS as a public threat. The government is mindful that HIV remains a major public health challenge in South Sudan, with about 140,000 people living with HIV and 8,100 new HIV infections in 2023. Notwithstanding the ongoing efforts, the country is still confronted with major barriers to scaling up comprehensive HIV prevention measures, contributing to the slower reduction in new HIV infection and undermining the overall goals to achieving epidemic control in the country. I commend the efforts of South Sudan AIDS Commission and the Ministry of Health for sustaining a struggle against HIV and AIDS amidst a major challenge of limited resources from the government. The government of South Sudan appreciates the support it has been continued to receive from various partners, particularly the Global Fund, PAPERS, UNAIDS, UNDP, and all the UN co-sponsoring agencies of UN Joint Program on HIV and the other donors whose efforts have helped reduce the numbers of new infections by 45% since 2010. While this is way lower than the average rate of 59% in the region, we know that South Sudan is faced with many challenges, including protracted humanitarian crisis and hard economic challenges. I'm aware that South Sudan, through the technical support of South-to-South Learning Network, joined the Global HIV Prevention Coalition, GPC, since March last year, 2023. I urge all the HIV actors and stakeholders in the country to utilize this GPC platform to learn from others and to share lessons. Various assessments indicated that several challenges are limited progress in HIV prevention in South Sudan, which include but may not be listed to: 1. Underfunding of HIV prevention program. 2. Our dependency on external funding source which is also reducing. 3. Weak and multi-sector coordination and gap in the legal and social operating environment. Limited or inadequate engagement of political leadership at national level and sub-national levels. My presence here today should be understood as a commitment from the government to try to find ways through which we can work with the partners. First, support the key pillars of HIV prevention, including tolerate program to address the unique needs of most vulnerable population, particularly adolescent girls and boys, and young women and men, and people displaced and impacted by humanitarian disasters. Second, mobilize all government to support integrated and holistic approach to prevent of HIV and AIDS, including promoting awareness of HIV and encouraging easy access to testing and treatment services. The foundational elements of awareness is still very much needed in South Sudan. Third, facilitating and enabling environment that eliminates criminalization and stigma against people living with HIV and generate demand for an uptake of prevention and treatment communities. 4, support community leadership and role of civil society in prevention and continue to mobilize resources so that we meet our co-financing obligation, including better funding of the South Sudan AIDS Commission to effectively coordinate HIV responses as well as to widely integrate it in different programs and sectors. Part of those efforts should include pooling resources to generate good and accurate data and information that inform planning. I trust that discussions that have gone on these last 2 years and what will follow will go a long way in enabling for HIV prevention. Before I conclude my remarks, I want to underscore the fact that every country has its unique challenges. The reality of South Sudan is different from what we'll find in other countries. I therefore urge all stakeholders in the HIV sector to promote open dialogue with the relevant government institutions to come up with responses that address the challenges facing South Sudan. We are looking for and welcome effective and open partnership. I thank you all for your commitment to HIV prevention, and I wish you fruitful deliberation. And the workshop is officially open. Thank you.